I want to go back to the transverse abdominis and show you what it looks like in an ultrasound. And to be able to understand how this muscle of the transverse also has another unique property, which is it wraps all the way around the body and connects to the posterior lumbar fascia, or the thoracolumbar fascia. And so it not only draws on the rectus sheath, like we just talked about, but it also draws on that thoracolumbar fascia, which is filled with the erector spinae and the multifidi muscles. If you notice on the ultrasound picture, you can actually see the curve of the transverse abdominis coming around the body, thickening as it contracts to draw the abdominal wall in, as demonstrated in the picture of the human to the left. When we look at the musculature of the low back, just like the anterior wall, there is a vertical pillar in the back, which is called the erector spinae. The erector spinae is made up of a number of muscles that run vertical, right, in the body and connect either onto the spine process, onto the transverse process, or onto the ribs directly. They all originate from the pelvis rim or from the lumbar spine. And these muscles run vertical, just like the rectus abdominis, and have an action arm of extension. So when these muscles contract, they're going to shorten the space and they're going to facilitate extension or compression in the low back, almost like a guy wire on an antenna tower or a building. And so again, needing that axial length that come from those other muscles we just talked about, the transverse abdominis and obliques and pelvic floor, to be able to have an efficient extension or efficient flexion that we would see coming from the erector spinae or from the rectus abdominis. We also see the large muscle of the latissimus dorsi, which comes down from the arm and connects the upper extremity into the thoracolumbar fascia. And so this is a diagonal muscle similar to what the obliques do in the front. It's going to come in and provide that same angle as the external obliques coming to the thoracolumbar fascia in the back. Deep inside that muscle fascia of the thoracolumbar fascia are the deep muscles of the back. These muscles, again, don't really have movement properties as far as the direction of movement, but they actually create stiffness and create the appropriate amount of control or stability around the spine based on the anticipated activity. The other unique thing about the multifidi is that it contains more than 6 times the number of muscle spindle fibers. These are your proprioceptive fibers or information fibers of where your body is in space. These are the deep local stabilizers. When these muscles are healthy, they're also hypertrophied inside of that thoracolumbar fascia and create a stiffness in their own right, just inside that fascia. So little gentle pulls on that thoracolumbar fascia can create stability and stiffness as well, just like on the anterior wall we talked about with the rectus abdominis sheath. Other muscles that are related in this area is the psoas major. We often think of the psoas major as a hip flexor, but really the iliacus is the hip flexor. And the psoas major comes up and has a relationship to our spine. And it not only goes up past the lumbar spine, but it has insertions up through the diaphragm into the lower thoracic spine in the anterior body or the anterior lateral body of the vertebra. And this is very important because if you think of the lumbar spine, let me just give you an example. If I was sitting sideways to you in the camera, my lumbar spine is going to be curved in its lordotic curve. The psoas muscle is going to come behind the axis of that lordosis as it comes up into my thoracic spine, which means if that muscle contracts on its own or by itself or inappropriately, it's going to collapse my lumbar lordosis. So a lot of times people who have compression and disc pathology have an overactive psoas major without the integration of the other muscles around the trunk, like the transverse abdominis, the obliques, the pelvic floor, and even just that good axial length, that sensation of drawing things towards the center axis. On the same note, that psoas major has some short fibers that are the most medial superior fibers that act like local stabilizers. So again, sometimes it gets so complicated, it's hard for me to even imagine and describe it. But just understanding and trusting that these muscles, when the skeleton is aligned correctly, they work efficiently. And we then see that we have increased power in our legs, our kicking activity, our running, jumping, when the psoas can work efficiently in relationship to the trunk and to the pelvis. Other muscles that are part of this organization of the pelvis to spine and pelvis to rib cage are the pelvic floor muscles. We talked about these a little bit in the breathing lecture, where the pubococcygeus muscle is the sling or the hammock muscle that connects the pubic symphysis back to the coccyx. And in the middle of that are the sphincters of our urinary tract and also our digestive tract, or the colon, and in the women's case, the vaginal sphincter as well. And these sphincters are suspended and held in place by this sling, which is called the pubococcygeus muscle. Other muscles that come into play here are some of the deep rotator muscles of the hip. So you see things like the obturator internus and externus, the gemelli muscles. You have the other rotators, for example, like the piriformis that come in and connect to the sacrum. So all of these muscles coming together, the iliacus coming across the crest of the iliac, that's a hip flexor, connects to the inside of the femur. All of these have a very complicated relationship to be able to maintain us in an upright and vertical position, which in itself is a miracle that we can do that so easily. These muscles, when they work inappropriately, or they have compensations, or they work too much or work too little, lead to other types of problems and complications or pathologies, which we can talk about later. What I want you to understand from here is to understand that these muscles in the pelvic sling are part of that hydraulic amplifier that help control the intra-abdominal pressure. And if we have too much constriction and too much contraction of our abdominal wall and pull things in too much, these muscles become ineffective. And we see this sometimes in overzealous Pilates and exercise teachers, that they over-recruit their abdominal wall so much that the oblique internus particularly gets a contracture and no longer allows the wall to expand, diaphragm doesn't descend, pelvic floor is always pushing down. When the pelvic floor is always pushing down, that leads to problems like incontinence and pelvic floor dysfunctions. Let's go back to the sheath, the rectus sheath. We talked about this relationship and the idea of the fascia. What I want you to imagine is the fascia is much more than just a connective saran wrap that goes around the muscles. It's actually a living and dynamic and communicating tissue in our body that connects all of our cells together. And it runs in all different directions based on the demand for us to maintain our uprightness and to move throughout space. The rectus sheath is no exception to the rule. The rectus sheath is also very dynamic and has a very important role of maintaining that anterior stability, but very efficiently. The way it's set up is like a hydraulic amplifier. You think of the fascia being stiff in this particular sense, stiffer than the muscle belly. If the muscle belly is developed and I put a little bit of pressure from one of those other muscles on that rectus sheath, it creates stiffness and power. The same thing in the lumbar spine. So these fascial planes, these fascial diagonals, these pillars vertical, create tremendous power in our body with very efficient muscle contraction. The same thing in the low back. When we look at the thoracolumbar fascia, we can see the connection we talked about of the latissimus dorsi coming in superiorly and diagonally. But if you look below, you'll see the gluteus maximus coming out inferiorly and diagonally in the opposite direction. You'll also notice that the transverse abdominis and the internal oblique actually come around the side and attach into the thoracolumbar fascia. Again, with so many different connections coming in with different angles, it's what allows our body to move dynamically and through complex movements spontaneously. If we had to think about contracting any of these muscles while we were dancing or moving through space, we would get in our own way and stumble over our own feet. The idea is to understand where the bones move and have that feeling of axial length, and those muscles are going to work automatically and efficiently through practice. Let's shift gears now and look at some of the inert structures that are also responsible for stability in our body in this core control. Ligaments, as I mentioned earlier, are made up primarily of collagen fibers, similar to the annulus of the disc. And the collagen fibers create stiffness. They hold the bones together. Their job is not to stretch. And inside of these ligaments are mechanoreceptors that tell us when there's stretch on them. So when we move our spine in a different direction and we get close to the end of that range of motion of that ligament, a little message is sent up to our central nervous system or to our spine that says that we're approaching an end of range. we have a very thick ligament in the front of our spine. This is referred to as the anterior longitudinal ligament. If you thought of the anterior curve or the lordotic curve of the lumbar spine, we would want that reinforcement in the front to make sure that we didn't collapse or shift forward. Some people who have injuries to that or weakness in that have a disease or an injury called a spondylolisthesis. So that's a loosening of that thick anterior longitudinal ligament, and the spine actually shifts forward on the lower vertebra. What we're looking at is what kind of muscles and fibers connect to that anterior longitudinal ligament to be able to help maintain that length. And earlier in the breathing principle, we talked about how the diaphragm has muscles that come down in front of that curve, how the pubococcygeus has muscles that come up over the front of it, and how the psoas and all the other muscles of the abdominal wall will create that drawing in of that lumbar curve and create that optimal length and support that ligament anteriorly. If we lose that support anteriorly and we lose our anterior wall and we don't have that organization, then we put those ligaments at risk of deforming over time and leading to degenerative and other kinds of dysfunctions in our body. Just behind the vertebral bodies is the posterior longitudinal ligament. And the posterior longitudinal ligament is much thinner and much more delicate than the anterior longitudinal ligament. This is primarily because we are meant to be a standing and walking animal, not a sitting animal. When we sit for long periods of time, we go into flexion, and we don't have the natural protection in a posterior glide of the disc for prolonged periods of time. And so what happens is the annulus fibers of the disc become challenged. It might have a little fissure or a tear, and eventually can result in what we call a disc herniation or a disc bulge. These disc injuries often are a result of prolonged flexion activities, which we still have not, over the last 100 years relative to millions of years, have not adapted to yet. Maybe some year we will. Right now, we want to avoid that long, sustained flex posture in our low back. The last ligament that I want to talk about in the lumbar spine is the ligamentum flavum. The ligamentum flavum gets the name flavum because that means yellow, and yellow represents elastic. So different from the anterior and posterior longitudinal ligament, which are much white and shinier and filled with collagen, the ligamentum flavum has more elastin, is actually made to stretch. So if you think of it being behind the spinal cord, connecting the vertebral bodies, it's going to have an elastic component to it that it moves and it can expand and come back in together because of the amount of movement that goes around the fulcrum of the disc. And that's very important for us to understand. I love to use the ligamentum flavum as an image of movement. So for example, if you just imagine having an elastic band connected to your head and your tailbone, and you moved in flexion, that elastic band stretched, and you let the elastic band recoil, it's going to pull your body back up. And so I love to use images that do not focus on the muscle themselves, but more on other structures of the body functioning normally through space at any given time. Let's take a look now at the ligaments of the pelvis. This particular photo I love because it really depicts the thickness. And when I've dissected out the pelvis in cadavers, it really is thick fascia, thick ligaments that are connecting the iliac and the sacrum together. Now this is really important because if these ligaments were loose or torn, there would be a tremendous amount of instability in the ground force coming up through our body, so walking and those kind of things. And what I want to make clear here is sometimes we hear the sacroiliac sprain or sacroiliac instability. I often think that is more of an L5S1 instability in most cases. And occasionally I've seen a true sacroiliac with things like severe car accidents during a pregnancy or things like that when the ligaments are a little bit loose getting ready for partum in women in their third trimester. But typically speaking, the pelvic bone will break or fracture before these ligaments tear. They're so strong. And if you think of them as being sort of like a suspension system in a really cool car. If I'm in a really hot Porsche and I'm driving around a curve really fast, the plates of the suspension down below absorb the force of the curve and push the tire in the suspension system back into the ground so that I don't feel the sway. Opposite of that, if I drive that old Chevy van from the 1970s with a very poor suspension system and I'm coming around a curve faster than 20 miles an hour, I feel this tremendous amount of sway going to the side because it's not absorbing that potential energy. It's just the whole centrifugal force is pushing that car over to the side. I think of our pelvis being like the Porsche suspension system. When our bones are aligned correctly, the potential energy absorbed from the ground in these ligaments and in these bones is the potential energy to accelerate us on the next part of our movement. And it accelerates, decelerates, accelerates, decelerates. Potential energy comes in, potential energy is released. And this is a very powerful concept for us in moving efficiently and getting out of that concept again of thinking that, oh, I need to use my quadriceps and hamstrings and calves to be able to run. Where if my body's just aligned well and I can get my body weight forward a little bit, actual energy is going to be stored and released in that pelvic and the other bones and fascia tissue of our body. And we notice that the very elite runners use very little motor muscle activity to be able to do long endurance runs. And that's how they're able to do that, to be efficient and build their endurance.